I always said, if we wanted to fix healthcare and have better outcomes for our patients, then what we really needed to do is have a team of great providers that work together over the long term. And in order to have build this team of world-class providers, we needed to offer expectations and work that seemed like a better deal than other places, ultimately. We wanted to, lower the burden of direct patient care. But what ended up, when you do that you're reducing your revenue to some extent. So the challenge that we were really facing was, how do we have the right expectations and still have a financially sustainable and growing business? And one of the really difficult parts with this in healthcare is you've got to integrate different platforms, different systems. So we've got our electronic health record system, which is kind of our core operating system, but then we've got our HR system, we've got our financial system, and we needed to bring all that data together, because when our team was doing this on their own, what would happen is everyone's numbers were a little bit different, or they calculated something a little bit different. They were downloading information, manipulating it, and putting it in a different spreadsheet. I got tired of being surprised, thinking we were doing better than we were, and then not managing. Essentially, it goes back to managing our data well, not having a single source of truth, and then getting blindsided. And this led us to really almost going under 3 different occasions. I had long had a hypothesis that the future of healthcare was going to be managing large amounts of data and making sure that it still felt very personalized, and using humans to lean into the thing that only humans can do and build those meaningful relationships. And I don't want to get blindsided by my team handling operations, and we need to get ready for what's coming with AI. And the first step in that is having good control over our data. So I immediately reached out to one of my friends who works in healthcare consulting, told him the problem that I had, and he said, okay, great. I understand your problem. You need to bring together a bunch of data and deliver insights, not just for yourself, but so that your team can manage from a single source of truth. So the first goal of the project that I had was in healthcare, especially in our current system. Most healthcare companies are what are called work on a fee-for-service model, meaning that a patient comes in, they receive a service, and you bill the insurance company and you're paid for that service. And what's challenging about that is every insurance company that you contract with has different rates. So you get paid a different amount for the same service across, different health insurance companies. And you've got maybe, in our case, 30 to 50 different services that we're billing for, meaning that we've got 30 to 50 services we're billing for across 10 to 12 insurance companies. And so you have to bring in things like PTO data, paid time off data, if the company has a holiday, in order to really know exactly how much work your clinicians were doing, and the work being how much you're going to get paid for that. And so the first problem we set out to solve was this clinical utilization. How do we bring all this information together so that we can manage our team really well? And so then after solving that, we started looking for the leading indicators that were going to get us to the utilization we needed. So while we started with just integrating our electronic health records and our billing, we then quickly had to bring in our HR platform. And then we even brought in other data sets from our, CRM, and then also our financial data. And so we could see when things were going wrong well in advance of them actually going wrong. So if we needed to increase our marketing efforts because we saw that a month from now, we weren't going to see as many patients as we wanted, so there were a lot less stops and starts. I've never worked with a company I've liked until FP&Automation. I get very frustrated when I feel like I am working with someone who is not an expert. And at no point in our engagement did I feel like that. The thing that was just incredible for me was we set up our recurring meetings. We had our normal check-ins. But then throughout the week, when something came up, if there was a fire that I needed to put out, something broke in a report, maybe something from our operating systems changed and we had to remap some data, the team at FP&Automation just stepped in, took care of business as quickly as possible, and really went above and beyond, I think, to understand our actual use cases and then deliver additional reports beyond the scope of exactly what we were solving for at the time. And so we have now ended up with a suite of reports that my colleagues in the field say is, they would dream about having. It's crazy to think less than a year ago, and I wrote this kind of manifesto of the next pivot. What is the next thing we're going to do in healthcare? And so again, we really needed to lean in and develop an understanding of our own data and start to build a coherent data model. I've always wanted to be more on the technical side as well, really integrating healthcare and technology together. And through our work with FP&Automation, we just have unparalleled insights. And so our managers and our, especially when we're talking about, psychiatrists, therapists, these are not always people who get trained on how to use data effectively to make decisions. Now that we have a single source of truth, we're just talking about facts and figures and how we can make the best decisions with those facts and figures. This has accelerated our growth, and I had no clue that, so now we're less than a year into our engagement. We've brought on a chief technology officer, and we're bringing on our first full-time developer in about a month. And none of this would have been possible if we hadn't had this, foundational data and analytics set up by FP&Automation. What I would say to anyone who's, asking themselves, do I need more sophisticated, data infrastructure? Do I need better reporting? If you're asking the question, then the answer is already yes. So if you have any questions about whether or not you should be investing the capital into a project like building out your data and reporting infrastructure, again, the answer is yes. And there's no one I'd recommend for that more than FP&Automation.